All right. Good evening, everyone. Good evening, and welcome to tonight's episode of Teen Talk Live. I'm so excited that you are here with us tonight. My name is Dillard. I'm a licensed marriage and family therapist and the host of this talk show. I'm so excited for another reason because I have a special guest with us, Dr. Tiffany Young, and you're going to hear more from Dr. Young. But I want you to tune in. I want you to share this out with your audience. If you know a mother who's raising a teen daughter, you want her to be able to listen to this because this is one of the pre-shows leading up to our mother-daughter telesummit that's coming up. So I want you to join us and hear these great nuggets that Dr. Tiffany is going to be sharing with us. So share this out with on your timeline in your groups, and let people know that Teen Talk Live is on, and we have the expert, Dr. Tiffany Young, with us. Welcome, Dr. Tiffany.
Thank you so much for having me.
Absolutely, absolutely. I am so glad that you agreed to join this discussion tonight on Teen Talk Live because we're talking about how to help our daughters with anxiety.
Yes. Absolutely.
Well, before we jump into our topic, would you share with the audience how do you serve in the world?
So I am Dr. Tiffany Young, and I am a expert mental health consultant, DFW's #1 expert mental health consultant. And I do a lot of trainings in schools, businesses, the community, and families to help them bring mental health to the forefront and just make mental health a more acceptable conversation.
That is so important because there is so much stigma surrounding the topic of mental health, right, even in 2019. And I think that is such an important conversation to have in all our sectors.
Exactly. And I love doing the trainings because a lot of people just don't know what to do when it comes to mental health and how to help their loved ones or even themselves.
Well, thank you for what you do. And I am so excited to talk to you and to share more about your book and your curriculum and just hear about all the fascinating things that you are doing. So let's jump into our conversation. Okay. Anxiety. Mm-hmm. That is such, that's such a common word that's tossed around often. Right. All of anxiety, or you're just anxious, or, it's used so commonly that sometimes I wonder if people realize that there is actually a clinical diagnosis.
Right, exactly. So anxiety is one, not only a common word, but one of the most common diagnoses in the mental health field. About 1 in 5 people have anxiety, including 44 million children. And so what I tell people about anxiety is remember that just because you worry, just because you have some anxiety does not mean that you're diagnosed with an anxiety disorder. There has to be criteria, things such as have your symptoms persisted for the past 2 weeks? Are your symptoms affecting your functioning? Is it persistent? Are you able to identify the triggers? Is it interfering in your daily life? So remember, just because you worry every now and then, all of us are going to experience some type of symptoms of anxiety. We all worry. We all have, scares and things like that. But that does not mean that you or your daughter or your loved one has an anxiety disorder.
I think that's really important because we are all somewhere on the continuum of worry, right? Or concern, some people might say.
Exactly.
Have that to various degrees, right? But it doesn't mean that you are diagnosed with anxiety. Mm-hmm. And I love that you brought up the points about what classifies a diagnosis of anxiety, meaning that you're experiencing an increase in symptoms for more than 2 weeks, or the symptoms are so advanced that they interrupt your regular functioning, your regular daily functioning. Right.
Right. And these are things such as your sleep patterns, eating habits, like if you're eating too much or not enough, going to work or school. If you're constantly not wanting to go to work or school, that could be a symptom affecting your life. If you're not performing the way that you want to be performing. So let's say, for instance, your daughter is used to making straight A's, and then all of a sudden her grades drop to D's or C's. And you know that she's been worrying a lot, that may constitute an anxiety disorder.
That is so important. And some might say anxiety and depression, they're twins, right?
Exactly. So anxiety and depression, like you said, they're twins. And so oftentimes when someone has anxiety, depression shows up right along with it. And those symptoms, of course, are symptoms of 2 weeks or more of sadness, not being able to identify the trigger. And another important thing is that you've tried your coping skills and they're not working, right? And that goes for anxiety and depression. So if you've tried your coping skills and they're just not working out for you, then you may need to see someone about an anxiety disorder or depression.
That is so important. So important. And so, having worked in schools, and I'm sure you're familiar with this, working in schools yourself, we see a lot of children, a lot of students who present symptoms of anxiety, right? And I'm seeing it even more right now because we are on the crux of the Georgia Milestone test, which is a standardized test that the students in Georgia are going to be taking. So thinking about the mothers who might be watching, how can they look for times when symptoms of anxiety will show up?
So things like distressing and persistent anxiety, like constant worrying every day. So more days than none, you have some type of worry. Also, like I said, problems identifying the source. So a lot of times, like you said, in schools, we hear kids that say, oh, I'm worried about something or I'm sad about something. But then you ask them, well, what's going on with that? Tell me more about that. Well, I don't know. I don't know. I just am. And so they have a problem identifying those triggers, is what we call them. Constant terror, feeling afraid to go outside, go to school. They make any excuse to stay at home from school. They talk about maybe bullying as well, if they're being bullied. They may also experience physical symptoms such as chest pain, feeling like they're choking, like they're falling, or in some other frightening sensation. They have unwanted thoughts, including those suicidal thoughts, and that's really important that we stay on top of that. And they have just, talking biologically, they have a lot of high metabolic activity in their frontal lobe area that controls their impulses. So they might have some acting out behaviors. They may have anger outbursts. They may have crying spells just because that frontal lobe is moving at a rapid rate.
That is so, oh wow. That is so important, and it's so right on time to have this discussion because there are many parents, many moms out there who, don't know really what to do with all of this because you can't see a physical symptom, right?
Right.
And it's like, why is your stomach hurting again? You're pretending or you're acting, and sometimes those physiological symptoms are real.
Right, exactly. Sometimes they present that way. And a lot of times when you have anxiety, you have to think about those subtle symptoms that you may not think about, like the stomach aches, like the withdrawal from friends, from family, wanting to stay in their room all the time, the increased sleep. Those are some really subtle signs of anxiety that you really want to pay attention to.
And so it's easy for a mom of a teen daughter to say, well, it's just teenage years. They're just growing, right? So that's why they're sleeping a lot. Or it might be that it presents as less sleep.
Want to stay up all night. Yeah.
Yes. And so as parents, what I find some of my parents doing, they might be like, okay, it's the cell phone that's keeping them up, it's the social media. But the child behind, is saying, well, I'm on the cell phone because I can't sleep.
Right. Or because I don't feel, I'm getting attention, or because I'm looking for instant gratification from a Facebook post or an Instagram post. If I post a selfie and I get 30 likes, oh, now I've got my instant gratification, right? And so I'm looking for that fulfillment for my anxiety that I'm having.
Right. And I think for those of you who are watching, we are joined by the anxiety expert, Dr. Tiffany Young, who is sharing, and she has an amazing curriculum. It's not available for us to buy, but she's going to share some about it. And she has an amazing book also that's available. And she's going to drop the link at the end of the show. But share this out. If you know moms of preteens or teen moms, moms with teen daughters, and I usually say daughters, but this goes for boys as well. But that's my primary audience. So I'm speaking to you if you have teen daughters. She's talking about anxiety and how to help your daughter learn and understand anxiety, how to help you learn and understand anxiety, and what to do about it, some of the things you can do about it. And if you're just joining us, one of the things that Dr. Tiffany said, we talked about, is how anxiety looks a lot like depression, right? And so we're going to continue this conversation. If you're with us and you have questions, please drop your questions in the comment section, and you can get answers from the expert tonight. All right. So Dr. Tiffany, thank you again on this pre-summit conversation about teen daughters and helping them understand anxiety. So if you're a mom and you're wondering if your daughter has depression or anxiety, what's one thing you could say to that mom?
One thing I can say is, don't be afraid to ask. Don't be afraid to ask your daughter those straight up questions. Are you feeling depressed? Do you think you're feeling depressed? Do you think you're feeling anxious, more worried than normal? Don't be afraid to ask, what's going on at school that you're wanting to stay home every day. Don't be afraid to reach out to experts and therapists and psychiatrists, primary care physicians. We're here to help you make those decisions and understand that. Also, don't worry about treatments and things like that. Depression and anxiety is treatable with therapy, with medication, and sometimes the combination of both.
Right.
Right.
And see, okay, so pre-mental health training, I might have been a mom who says, well, if I introduce the topic, then that means I'm introducing that subject to my daughter, and she might not have been thinking about it. So because I said that, that's putting it in the atmosphere, and she might be inclined to be that, right? We talk about that with suicide ideations as well. So talk to us.
And I really want to let those moms know that research shows us that you introducing that topic or talking to your daughter about these topics does not put that in her head. Including, like you said, with suicidal ideation, we have to ask those straight up, blunt questions so that we can get the answers that we need as a mom. I'm a mom as well. I have a 7-year-old daughter. And I want to also protect her from all the, things in the world. But there are some things that I'm going to need to know, and I have to be ready to ask those straight up questions. The other thing on that, though, is when you ask those straight up questions, be ready to get the straight up answer, right?
Exactly. And know that when you ask those straight up questions, your response is going to really determine what happens next.
Exactly. So our responses as parents, as educators, as teachers, as counselors, even as friends and family, can either escalate or de-escalate a situation.
Right, right.
So how you respond and how you're supportive is going to allow your daughter to give you more or give you less.
Awesome. So can you give me some ideas of appropriate or let's do the non-appropriate responses first.
So for example, if my daughter came to me and said, Mom, I asked her a question about anxiety and she told me, yeah, I'm feeling a little bit worried, saying things like, you don't have anything to worry about, you're a kid. that
Right?
that would kind of shut her down, maybe, or shut your daughter down. Or saying things like, just, I know this may not be the popular one, but just pray it away. That
Yeah.
one as well.
Yeah.
Saying things like, oh, you're just tired, you're not anxious, don't talk about that, you don't have any mental illness.
Or don't claim it.
Right, we don't claim it. Or toughen up. Especially, I know we're talking about daughters, but I think our sons hear that a lot as well. Toughen up. You don't need to cry about that. That's nothing significant for you to cry about.
Exactly. Or in some instances, I have parents who proceed to share their own life and say this, this is why you shouldn't have worry or anxiety, because I've had to go through, not that you're sharing your story, but I had X, Y, and Z to deal with. So why are you worried about, which means that they're minimizing their child's experiences.
Exactly. And one thing that we don't understand as parents, and I've learned this just working in the mental health field, that our children are now growing up about 10 years faster than we are. So something that you were dealing with at 14, well, their mind is already at 24, so we just never know what they're going through. Plus they have a lot of social media that we didn't have back in the day. There's so many adolescents deal with that identity crisis thing and trying to figure out who they are. And because of social media, there's so many choices about who they can be, and social media telling them who they should be, and you got to look like this and you have to have this. And so that, I think that in itself causes a lot of anxiety in our adolescent girls and boys.
Yes, and I think you're so right. They are 10 years ahead in information, but their prefrontal cortex still has not developed.
They're still a kid.
They can't handle it. It's like information overload,
right,
comparison overload. And where does that go? It usually is internalized.
Exactly. And that's how, we get a lot of the bullying and a lot of feeling like I'm not good enough. Right. And with anxiety, like we talked about, it presents in so many different ways. And one of those is fear. And so fear of rejection, fear of being embarrassed by, not feeling good enough, fear of not being loved, and things of that nature. And then it also presents as anger. And so, if I'm being bullied and I'm anxious about that, I may project that as anger to show my bully, you're not going to mess with me. But that's really anxiety in the background.
Absolutely. And in some institutions, including school, it's easier for you to deal with anger than to say, I'm afraid.
Very, very
right. And it's like anger. I think, I used to teach my kids, that's a secondary emotion. So let's peel it back and see what's behind this anger. Were you embarrassed? Were you scared? Were you disappointed? Right. But, in some instances, you'll see people might call you weak or other names, other choice names that are not so good if you talk about being embarrassed. It's more cool to be angry in some instances.
Exactly. And what I also want, even any teens that are watching and moms, that anxiety has absolutely nothing to do with courage, nothing to do with your character. Anxiety is an emotion that all of us feel. However, some of us feel it more than others. Right. And that's where we get the mental illness or diagnosis of anxiety. And when it gets to that point, just like any other illness, we may need some outside help from therapists, psychiatrists, primary care physicians, and things like that.
Absolutely. Absolutely. Okay. So here's a hot topic with my population, cutting. And a lot of which is a self-harming behavior. A lot of parents, when they find out that their daughters are cutting, if they find out, they're usually afraid that, oh, they're trying to kill themselves or they're trying to get attention. Mm-hmm. What do you have to say to parents on the topic of cutting?
Cutting, like you said, is a self-harming behavior. And most of the teens that I work with that cut let me know that it's not a suicidal attempt. It's mainly to rid themselves of pain, or it is also a self-soothing mechanism. And although it is very scary and does need treatment, it's very serious and it does need treatment. It's not as scary as, say, a suicide attempt to actually slit your wrists. And teens can find things to cut with, like even little things. We think of the most common thing as a razor, but sometimes they will cut themselves with paper clips, staples, anything that they can break and make a sharp edge may be used to scratch and or cut themselves.
Pencils, just anything that they can use.
Yes, anything that will create a scratch or a mark on themselves. I've seen some teens that they don't actually break the skin. They're just scratching themselves and creating marks on themselves. And then when they don't have the coping skills that they need, they revert to that self-soothing of the cutting, because it's kind of like it gives the same feeling as having a teddy bear or having a blanket. It's a soothing mechanism for that teenager. Oftentimes, cutting is a groupthink activity. So if our teen daughters are in a group of girls that cut themselves or talk a lot about cutting themselves, they may lean more towards trying the cutting as a coping skill.
Absolutely. And I think it's important for parents to know the difference between an attempted suicide versus cutting for self-harming or self-soothing behaviors. And I think, and correct me if I'm wrong, I think a lot of times cutting stems from having feelings of anxiety.
Very true. Very true. It's less depression. It is not often about depression. It is a lot to do with anxiety and feeling anxious. So we'll have those kids that, pop their rubber bands on their wrists. Yes. But some kids do cutting instead of the popping the rubber band. So a lot of replacement behaviors that we try to utilize with cutting is the popping of the rubber band, because it gives that little sting, but it's not a cutting.
Right. And look, I have my rubber band here. I give it to my teen clients, like, pop to snap yourself out of it. Right. Because you're right, it doesn't. And then some of my clients, I give them red permanent markers. Mm-hmm. To write on themselves. If you feel like cutting and it's a self-soothing thing, write on yourself with this marker. Or I might recommend that they use ice cubes to get that sensation, because some of them talk about, I just want to feel something. Right. Or I just want to stop this feeling of I'm so anxious about this, I just want to stop it. So I tell them to use things like ice cube in their hands, or run your hands under some cold water to kind of help switch your mind.
Right, because that feeling, and I like the marker exercise. I've done that one as well, because some teens, it's about seeing the blood. And if they can just see the red, it'll replace that behavior. So a lot of cutting, I know it's old and, old school, where we had B.F. Skinner and things like that. but it is about replacing that behavior with another behavior.
Absolutely. Absolutely. So finding different things to help them to do is
Right.
is so important. It's so important. But again, when you find out as a parent, how you respond is everything.
It's everything. It's going to escalate or de-escalate the situation. You don't want to elevate that situation to where it is now a suicide attempt. Again, both of those suicide attempts and cutting do require some form of treatment. Sometimes, like yourself in your practice, we do take on cutting in our private practices. It really just depends on how comfortable the clinician is with it. Other clinicians will send a client directly to the hospital for evaluation. So it's really just how comfortable the clinician is with the behavior and how they feel that they're confident in replacing that behavior.
Right. And I think also, just like we say for the parents, don't overreact. I think also for the clinician not to overreact.
Exactly.
But again, like you said, everybody is not comfortable dealing or working in that arena. So either refer out or get some other help.
Other guidance, right?
I think this conversation is really, really important. I see some new people joining us. Thank you for joining us. I'm talking with the anxiety expert, Dr. Tiffany Young, tonight, and we're talking about helping your daughters to deal with anxiety. And some of you might need help dealing with anxiety yourself. So thank you for joining, and remember to share this out. And if you have questions, drop it in the comment section so you can hear from the expert yourself tonight. Hey, Deborah, yes, I'm back from Africa and I am back in the swing of things. Thank you for joining us tonight. So Dr. Tiffany, what do we do? Oh, she said, what about the boys? Okay. Well, that's a fair question. Let's talk about the boys a little bit.
Yeah. So again, the boys are included in that count of the 44 million children that are diagnosed with an anxiety disorder. And what I see most from young men that are presented with anxiety is anger. That is the most feelings that they have, is to express it within anger. And a lot of times, like what I said earlier about non-appropriate responses, is that our young men are often told to suck it up, to toughen up, don't express your feelings, be a man. And that is what is kind of keeping them from being able to express those softer emotions, such as sadness, worry, fear, is because, our culture tells them that they have to be a man. So I think that as a parent, in supporting a young man who may have anxiety, is to encourage him to express his emotions, his true emotions.
I think that's true. I that is so key, because earlier in this broadcast, we talk about how anxiety and depression are twins. And these are some of the precursors to what could cause people to have suicidal ideations or even attempted suicide.
Right.
Exactly. So when I think as we talk about boys, it's important, and I don't remember the statistics, but it's important to realize that boys are more likely to complete the act of suicide than girls are.
That's very true, because they use more lethal means.
Exactly. Girls might attempt more often than boys. I think it's like 15 times more attempts that girls will make, but boys are more lethal.
Right, exactly. And, with untreated anything, even with physical symptoms, with physical ailments like, diabetes and heart problems, when you don't treat those things, it exacerbates to something larger. And so the same goes for depression and anxiety. Just think about yourself as an adult, if you're watching as adults and parents, when you don't talk about something, or when you have depression, or when you're feeling anxious and you don't talk about it, you don't express it, you don't get help for it, it creates a larger problem. And so when we're talking about our teenagers, it's even worse because, again, their frontal lobe is not developed like ours is. And so their impulse control is not there. And so if we don't allow them to express their emotions, to get the help that they need, it could definitely lead to a larger problem and a more exacerbated mental illness.
I think that is so important because when it comes to a teenager, because their frontal lobes are not fully, it's not developed yet, things seem like, it's everything is a crisis, everything is an emergency, and it feels like the world is coming to an end right there.
Right this instant, exactly.
And so as adults, we might have a better insight, but there are some adults who live in that crisis situation too. But for the most part, we're able to say, you know what, if I just do the proper things and just wait it out, this will pass. A lot of kids don't have that capacity.
Right. They don't have the de-stress tolerance that we have. They're not able to, and like you said, some adults also do not have the de-stress tolerance, but really with teenagers, they do not have the capacity to handle stress, especially stress that is abstract or stress that is beyond them, because their world is them. It's their box and their friends. So if something is wrong within them or within their friends, it's a catastrophe.
It is. Period. It is. And I think we have to talk about that and encourage the moms not to minimize that.
Yes, just because something is not a catastrophe for you does not mean it is not a catastrophe for your teenager.
Bottom line. Yeah. Bottom line. And I wasn't always sensitive to that. Believe me, I've raised 3 adult children now. Well, they're not children. 3 young adults now. But, looking back, sometimes I'm like, oh, I wish I knew that. But because it didn't seem to be on that grand scale to me, sometimes I was dismissive of their crisis and their catastrophes.
Right. And what happens when we do that as parents, when we're not sensitive to that, is, again, our response can escalate or de-escalate the situation. And sometimes you have those kids that will start to act out, or they will hold everything in.
Yes.
And I think one of the most scariest and kind of dangerous people are the ones who hold things in.
Yes. Yes.
Because when they do let it out, it's going to be everything that they've held in. Yes. And again, we don't know where their mindset might be when they do release those feelings.
And it's going to be all over the place. And so I think it's important. And Deborah says, what if they don't want to express it? Now, that's a really good question.
That is an awesome question. And, I think that a lot of times teens, and we were all teens at one point. And so I think a lot of times teens don't feel that they have a safe space to express their emotions. Again, there's such a culture of keep it in, don't express your feelings, toughen up, it's not that serious. We have to sometimes we have to rebuild a relationship with our teenagers, not saying that any parent does not have a relationship with their parents, but sometimes we have to relearn our children every day because they're constantly changing, and we have to constantly reinforce that this is a safe space. You're able to talk to me. And the way that we do that is, like we said, with your appropriate responses. Absolutely. We create that trust.
Right. And I think if you're unable to do that, I also recommend structured extracurricular activities, like sports or taekwondo or different things like that, where they're also learning self-discipline. They can build their self-esteem, and they have some kind of physical outlet that's constructive.
Right. As well as seeking professional assistance.
Yes.
Us therapists, we have a different way of talking to people. We have gone to school for 8+ years to learn to talk to people. And so sometimes our parents, they get discouraged, but we are here to help you with this.
Absolutely.
Because we may have a different approach. We have so many different tools in our toolbox to help your teen start to express their emotions.
Yes.
So don't be afraid of therapy. Remember that, you go to your doctor for a simple cough. It doesn't have to be a heart attack for you to go to your doctor. So if your teen is having problems expressing their emotions, a therapist is a good way to go.
Absolutely.
Because it does not have to be a catastrophe for you to call us.
Absolutely. And we would prefer that it's not a catastrophe, because if you call me of a catastrophe, I'm going to have to send you to a crisis center.
Exactly.
And work with you after that. Exactly. Right. And it's okay that you pray. Prayer and therapy goes a long way.
They go together.
They go together, and that's really critical. And I think that especially if you grow up with the old church, in the old church system, therapy was seen as a bad thing. But if I could help people in the religious arena to just dispel the myths around therapy, to say that yes, pray first. Mm-hmm. And also, there's nothing wrong with inviting a therapist to help you walk through, because like you said, we've gone to school, we've had hours of practice, and we've had to build this extensive toolbox by which we use to engage and help people find solutions.
Exactly. And, I want to commend, the preachers and the deacons and things like that about how they are bringing therapy into the churches now. And I'm really proud of that. And that's a big step and a huge step. And one of the things that I want to say about therapy is that oftentimes the same messages that our preachers are giving us, we give you in therapy. It's just a different way.
Absolutely.
And so we're not going against any of your religious preferences or things like that. And I often say, survey your congregation, and I promise you there's a therapist in there.
Yes.
We are also a part of God's body as well. And so we're not taking any religion away from you. We want you to pray, but we're also here to help you. And I do believe that God has put us here as one of his vessels to help his people.
Absolutely. Because, for example, one of the modalities that I use is narrative therapy. And that's talking about the narrative that you formed about yourself. And depends on the religious background of my clients. I use scriptures, and I tell them to search the scripture. Who does God say you are?
Right.
Let's come back with 5 scriptures that God said who you are through the word. Mm-hmm. And so I think it's important to know that, just like you so eloquently stated, as a therapist, you're not trying to take away any kind of religious doctrine or anything like that. This is a great tool to support healing.
Exactly.
And so I appreciate it. Catherine, thank you so much for joining us. I appreciate you being here. Pastor Brewington, thank you for being here. And I just want to say, if you're catching us tonight, share this out so somebody can benefit from this. If you're catching us on the replay, let us know that you're watching it. And please share this out. This is a pre-conversation to our mother-daughter telesummit that's coming up on May 8th, 9th, and 10th, where we'll have 15 dynamic experts talking about things that affect the mother-daughter relationship. We have 12 dynamic topics, and it's only $27, and you'll have lifetime access to all those resources. So share this out. join us and you know what? Get it for somebody as a Mother's Day gift. Bottom line. So Dr. Tiffany, as we wrap up this conversation, what do we miss? I think we covered symptoms, we've covered treatment, we've covered appropriate responses. So for, again, the mother who is dealing with the anxiety of her daughter or her own anxiety. Now, one question I didn't ask is anxiety, is it hereditary?
It can be.
Okay.
It can be learned. Some other causes are trauma, and somebody who's been through trauma. Of course, those biological, sometimes people have brain issues, the shape of their brain, the metabolism of their brain, environmental issues. And one of the things that I want to mention is parent paranoia. Sometimes as moms, we project our anxiety onto our children. Things like, going over to a friend's house or walking to school by yourself. Of course, we want to be very, very cautious, but sometimes we project our anxieties onto our children and create anxiety in them that they didn't have to begin with. And so just be very careful of that.
That is so true. And I'm so glad you said that. In environmental, living in a community, especially where your children, they're constantly hearing gunshots, or, they're constantly seeing those balloons in Teddy Bear Memorial, which invokes trauma as well. Exactly. And then the other thing with the current governmental system in place, that creates a lot of anxiety in our children that a lot of times as parents we overlook.
And we don't think they should deal with.
Exactly. And I think we have to, as parents, do a better job of paying closer attention to those environmental issues.
Exactly. And remember that we talked about treatment, and there are a couple of things we can do for anxiety treatment. And one of them is therapy. And then the other one is medication. And a lot of times our parents get kind of iffy about that medication. But when I talk about biological causes, sometimes therapy won't fix the biological. It has to be medication. And sometimes medication won't fix the environmental. It has to be therapy. So the best treatment that I can recommend is a combination of both. So I would say start with therapy. I'm biased, but start with therapy.
I am too.
Okay. And then if therapy does not work to increase their coping skills and help them out of some of their issues, then we may refer you to a psychiatrist. And if we, the therapists, are saying, I want you to see a psychiatrist, there's a reason for it.
Absolutely. And that's, and I think something that I explain to my clients is that if you go to the psychiatrist and you get medication, you have to follow through. If it doesn't make you feel good, then you have to follow through more consistently. Don't just stop.
Right. And medication, one thing about medication is it takes 4 to 8 weeks to get into the system properly and see a change. Also, you're going to probably feel worse before you feel better, because those medications are messing with the chemicals in your brain.
Yes.
And so they have to settle. And that takes about 4 to 8 weeks for any change to occur. And so I often tell parents, wait the 4 to 8 weeks, please, before you just stop the medication.
Yes.
And your child is going to feel jittery. They're going to feel, more anxious before they start to calm down and even out.
Yeah, because you are really introducing something foreign into your body.
Right.
And it's going to take some time to adjust to that.
Exactly.
But I'm with you. Therapy is my first resort. Medication after if it's needed, but I definitely push it. And even if for my clients who are on medication, I absolutely say therapy is a must for me. Right. Because medication don't teach you coping skills.
Not at all.
and so you still need to learn those coping skills.
Yeah, medication's not going to get down to the root cause of why your child is anxious in the first place. But I also want to say therapy also is not a quick fix. It is a 4 to 8 week process as well, even more depending on what you're going through. So it's really about trusting the process. I know that mental health is a difficult thing. There's a lot of stigma around it, but trust the process and trust the experts. We do know what we're doing, and we will consult if we need to.
Absolutely. That's the great thing about going to a therapist. You have a whole network of people at your disposal. Mm-hmm. Because we consult, we share, we talk to each other, not necessarily about your business, but about what symptoms we're seeing and trying to find the best way to help you move towards healing. Right. I think that's amazing. It's a win-win for me. Yeah. Well, I am so excited again that we've had a chance to have this conversation. Catherine says, therapy has taught me a lot about gaining skills and helping myself. Yeah, kudos to you, Catherine, to take that step, because it's an important step. It's an important step. So again, this has been Teen Talk Live with Ann Dillard. We have talked tonight with Dr. Tiffany Young about anxiety in our daughters, understanding what anxiety is and how to treat it. And so, Dr. Young, as we close this session of Teen Talk Live, would you leave some closing remarks with our audience and also tell them how to reach you and what products you have?
Sure. One thing I just want to close with is remember that anxiety is not about your character or your courage. People that have anxiety are some of the most bravest people that you will know. They're creative, they're energetic, they're happy, but they just they feel a little bit more deeply than other people, oftentimes. I am the CEO of TY Mental Health Consulting. And you can reach me on Facebook at the same, TY Mental Health Consulting. You can also reach me on Instagram at the same as well. Or my email is info@drtiffanyyoung.com. I can be reached there as well. I do have 2 products for you. One of them is, I hope you can see this, my children's book, Amaya and Friends See a Counselor. And it takes our little brown boys and girls inside of a counseling session. And so I really love it. It kind of demystifies the stigma of a counseling session, what it's going to be like, and it really starts them early. So this is for children in kindergarten to 3rd grade. And this can be purchased on Barnes & Noble online. And then my curriculum is What, Why, Mindset Reset. Again, like Ms. Ann said, this is not available to buy, but it is in the schools. And this is for our Tier 3 students who are having behavioral problems, anger problems, and it takes them through every what has a why. And it was developed by Tamara Taylor, EDU. She's a publisher, and I authored it.
Oh my goodness. I love that. Every what has a why. Yes. And as adults, if we can take that instant when we might be frustrated with somebody's display of their anxiety or worry, and think about it, every what has a why. I wonder, and be curious about why this person is behaving or presenting these behaviors. I think we would do them a much better service.
Right. We focus so much on the what, and we don't think about the why. And I think that Tamara did a really great job in developing this program. And I was just so honored to be the author of it.
That's amazing. And also, Dr. Tiffany, I'm going to share with others too. You know that if you've been following me, I've been promoting these grounding beads, and grounding is a really important part of dealing with your anxiety as well, feeling grounded in whatever situation you are in. So I do have these grounding beads, and they come in many different colors. So if you are interested, drop your information in the link in the comment section, and you too can have uh, know how to get a grounding bead to help in situations where you might be feeling anxious, or your daughter might be feeling anxious, or your son. Right? Okay, so this has been another episode of Teen Talk Live. I'm so excited that you're joining us live or on the replay. Please don't be selfish with this information. Don't be stingy. Pass it on, share so other people can be healed as well. Somebody said, Dr. Young, what is the title of your children's book? And she is going to drop it in the comment section with a Barnes and Noble link, Catherine, right after we end this broadcast. Thank you again so much. And Catherine is a librarian in the Twin Cities. So, right. Let's get this out there in some libraries.
Definitely.
And, I really appreciate you all again joining us and sticking with us. And let us know if you enjoyed this broadcast. I certainly did. And have a good night. See you next time. Bye.